In the previous video, we have seen about the mechanism of radiation poison, and also we have classified the symptoms based on the exposure of the radiation to the body. In this video, let us see about the management of radiation poisoning and its prevention. So the onset of the type of symptoms depending on the radiation exposure. So you have a quantity wise here. Relatively smaller dose result in gastrointestinal effects such as nausea and vomiting, and also symptoms related to falling blood counts and predisposition to the infection and bleeding. Whereas larger doses can result in neurological effect and rapid death can be observed with the higher exposure of radiation to the body. So here in this table we can observe the symptoms wise classification of radiation poisoning. It's based on radiation exposure and contamination. So it's taken from Merck Manual Professional Edition. So now these are the symptoms which can be observed during the radiation poisoning. So the symptoms which include nausea, vomiting, diarrhea, headache, fever, dizziness and disorientation, wakefulness, fatigue, hair loss, bloody vomit and stools, infection, poor wound healing, low blood pressure. So here in other side we have quantity of poison exposure. We have mild exposure, moderate exposure, severe exposure and very severe exposure. So coming with GI, nausea and vomiting in mild exposure itself within 6 hours we can see that symptoms. Whereas in moderate within 2 hours, in severe exposure within 1 hour, whereas very severe exposure within 10 minutes vomiting and nausea can be observed. In mild exposure we won't come across with diarrhea, headache and fever. So diarrhea can be observed within 8 hours in moderate exposure, in severe exposure within 3 hours. Whereas in very severe exposure where 10 gal or higher exposure, so within 1 hour diarrhea can be observed. Coming with a headache with a moderate exposure within 24 hours, in severe exposure 4 hours, within 2 hours of very severe exposure headache can be observed. Coming with fever within 3 hours can be seen in the moderate, 1 hour in severe exposure, within 1 hour very severe exposure will come across with fever. Coming with dizziness and disorientation only in the severe exposure and very severe exposure we have this. In severe exposure it takes weeks to gather time, within a week it starts showing the symptom, whereas with the very severe exposure immediately it starts showing dizziness and disorientation. Weakness and fatigue can be observed within 4 weeks in mild exposure, within 1 to 4 weeks in moderate exposure, within 1 week of severe exposure. Very immediately it can be seen in very higher dose exposure. Hair loss and bloody vomit and stools, infection, poor wound healing and low blood pressure can be seen in moderate exposure, severe and very severe. In moderate exposure within 1 to 4 weeks the symptoms can be seen, and severe exposure within 1 week, and very severe exposure immediately the symptoms can be observed. So now let us see about the treatment and drug. As I told, there is no antidote for radiation poisoning, so that we can decontaminate the body or we can try symptomatically to treat the patient. But long exposure or short exposure of very high dose are very much dangerous. Now let us see about the treatment and drug. The treatment goals for radiation sickness are to prevent further radioactive contamination, because we don't have antidote. So treat life-threatening injuries such as from burns and trauma, and reduce symptoms and management of pain. These are the three objectives or goals we can set for the treatment of radiation poisoning. So decontamination may sometimes saves the life also. Decontamination is a removal of as much external radioactive particle as possible to protect the body from further contamination. So this can be achieved by removing clothes and shoes, eliminate about 90% of the external contamination, because they will act as a source for exposure. So gently washing the water and soap removes additional radiation particles which are present in the skin. So thereby further decontamination can be prevented. So then coming with the treatment, as you have seen the symptoms, symptomatically the treatment should be started. Treatment of damaged bone marrow, a protein called granulate colony stimulating factor which can promote the growth of white blood cells, may counter the effect of radiation sickness on bone marrow. So that bone marrow can be get stimulated for production of the white blood cells. As we know, like immunity is very less in a person and chance of infections are also very much high. So may increase the white blood cell production and may prevent subsequent infections. So this one target we have with the bone marrow treatment. And treatment for the internal contamination. So now potassium iodide, so it's called as thyroid shield, can be used. So this is a non-radioactive form of iodide because iodide is essential for proper thyroid function. The thyroid become a desensitization for iodine in the body. If you have internal contamination with the radioactive iodine, so the thyroid will absorb radioiodine just as it rather from other form of the iodine. We have other possibility of using Persian Blue, as potassium iodide can protect the thyroid functions by protecting the thyroid gland. Now Persian Blue, this type of dye binds to particles of the radioactive elements, so known as cesium and thallium. So the radioactive particles are then excreted from the fecus, so thereby we can protect the body from the harmful effect of the radiation. So sometimes long-term effects these substances can show. Persian Blue can evacuate the substances. So then we have DTPA, diethylene triamine pentacetic acid. So this substance binds to metals. DTPA binds to particles of the radioactive elements plutonium, americium and curium. So the radioactive particle pass out of the body in the urine, so thereby reducing the amount of radiation absorbed. So now up to now we are talking about the decontamination of the body from the harmful radiation. So now let us see about the protection, because once the damage happen, so it will be irreversible, permanent damage can be absorbed. So damage by the radiation is irreversible. Once the cells are damaged, they do not repair themselves. Until now there is no way for medicine to do this. So it is important for someone who has been exposed to radiation, immediately they should seek the medical help, so thereby they can protect themselves from further damage occurs by the radiation. Now possible treatment includes like removing all the clothes, because contamination can be prevented, rinsing with water and soap, even use of potassium iodide to block thyroid uptake. If a person inhales or swallows too much of radioiodine, we can protect the thyroid glands. And Persian Blue in a capsule can trap cesium and thallium in the intestine and prevent them from being absorbed. So this allows them to move through the digestive system and can leave the body in a bowel movement, because we know like GI damage can be absorbed because of the radiation poisoning. So up to now we have came across with the symptoms and management of radiation poisoning. Let us summarize the treatment of poisoning. So this radiation poisoning can be treated by decontamination, so that we can prevent the body from further accumulation with the toxicity, because there is no antidote available. So now the major target in the treatment is treatment for the damaged bone marrow, where we are going to treat bone marrow so that it will regain its WBC generation. And also the treatment for the internal contamination, where we will be using various chemical agents to excrete out the poisonous radioactive substances which got enter into the body. Like potassium iodide can be given so that they can protect the thyroid gland, and even Persian blue can be given. It can eliminate the substances from the body to the bowel movement. And we have DTPA, diethylamine pentaacetic acid. So here, with the help of these substances, some of the radioactive substances may be get excreted out from the urine. This is how we can protect. But already the person will be having some of the symptoms. So we should address such symptoms also, because these treatments matters only for prevention of further exposure. But already if a person is having some of the symptoms because of the already exposed radioactive substances, so that should be treated. So now for that purpose we will be going with a supportive care treatment. If radiation sickness may receive some of the additional medications or intervention is required in such condition to treat bacterial infections. So this bacterial infection can be treated by giving antibiotics. Rationally it can be checked the cause for the infection, and the treatment can be given depending on the sensitivity pattern of the antimicrobial agent. When headache and other types of body pain should be treated by giving analgesics, and fever in some of the stages we can observe, so that should be addressed by giving antipyretic agent. Diarrhea and nausea, vomiting should be treated separately, so which can be observed in some stage of radiation poisoning. And dehydration should be addressed by giving IV fluids. Even burns and sores or ulcers should be treated separately by giving separate treatment. And also cardiovascular abnormalities are observed, and respiratory abnormalities. In such conditions, separately supportive care technique should be used, where we should treat by giving ABCD with all the patients who have difficulty in vital organ functions. These are overall explanation related with the radiation poisoning. And in the general principle of toxicological management, so whatever the general principle we have utilized for the management of any type of poisoning, the same can be used over here also, because here also we don't have antidote. Symptomatically the patient should be treated by using supportive care, and further exposure should be strictly prevented by using the technique what we have discussed. This is all about the radioactive poisoning. Thank you.